Hello, I'm Dr. Guy Yatros from Dental Sleep Solutions and DS3, and welcome to this edition of Dental Sleep Medicine Insider Magazine. Today we're going to talk about successful treatment in dental sleep medicine. In particular, what you do when you're struggling on a follow-up titration study on getting your patient's AHI below 5. We have to first ask, for this particular patient, does this even matter? Is that a goal that we felt we were going to achieve? Because when it comes to dental sleep medicine, it's like a different recipe for each patient. It depends on the pre-existing AHI, depends on what our goals of treatment were, both symptoms and AHI, and sometimes we can't get the AHI below 5, but when we weigh the differences between CPAP and dental devices, and maybe the patient wasn't able to wear CPAP or weren't wearing CPAP, a dental device at an AHI of 8 is an acceptable treatment outcome. We have to keep in mind that obstructive sleep apnea is a syndrome, and AHI is only one measurement of the success of that treatment. So when we're looking to measure success, the first thing we have to do is try to understand that there's two parts of the success. We have both subjective and objective goals. In other words, the patient's symptoms need to be improved, as well as the overall sleep study results with AHI, but other things go into that too, such as the SpO2 readings, percentages below 90, LSAT, O2 nadir, in other words. All these things come into play. So all that being said, that could be a whole nother lecture, but if we're struggling to get the AHI below 5, there are some things that you can do to further make your devices work better on a measurable level. First of all, we know we can titrate the devices. We can move the devices more forward, and typically that gets better as further we go forward, and we'll remeasure the devices at a forward position. Oftentimes we'll do a sleep study at multiple positions in order to see where the best titration forward is. We can also promote nasal breathing, and I think this is probably the most important thing we can do if we're struggling with our patients getting their AHI below 5, or even struggling with their symptoms. If we can get them to close their lips and breathe through their nose, they're going to do much better. Oftentimes this involves adding elastics to certain devices, making the acrylic thinner. We can use nose cones, we can use breathe right strips, we can even tape the mouth shut in order to promote nasal breathing. And one big thing here in Florida is allergies. If we can get patients to breathe through their noses better by maybe working with their physician to get them on Nasacort, Flonase, or one of the other topical steroid sprays, it can really make a big difference with very few side effects. Speaking of the nose, we can try something called EPAP. A lot of you may not be aware of these. Provent's a trademark name. We have these little valves that we can put on the nose, and basically allows air to go in but not as much air to come out, and it creates positive pressure back into the airway and helps keep the airway stable. Oftentimes we need to combine this with keeping the mouth closed as well in order to not let the air escape. So we have some success with prescribing EPAP or working with our physicians with EPAP. Positional therapy is also something that's often underutilized. We can get pillows or different methods that we can use to get patients to sleep on their side. If we know going into treatment that the patient has worse apnea in the supine position, then we can know that adding one of these positional therapy techniques down the road might be indicated and very well may help our overall therapy. We can add supplemental oxygen to some of our patients. Oftentimes, many of the patients here in Florida are elderly, and some of them have COPD, and even though we're doing an okay job of opening up the airway, we're not completely getting the oxygen levels to where we want because of some underlying pulmonary dysfunction. And if you work with the physicians, talk to them about ordering nocturnal oxygen to wear with their dental device, it can make a huge difference. Also, we can combine CPAP and dental devices. So often if the patients don't object to CPAP, but the pressures are high, we can do tap PAPs, we can do custom masks, or we can just make a dental device that they wear, hopefully low profile with the lips sealed, so that they can use nasal CPAP if possible, or use a full face mask if not possible, and we can have incredible success with that when we combine CPAP and dental devices. Well, if we can't do all these things, the other thing we can often do is open up the patient's vertical. So sometimes if you just make a little more room for the tongue, the devices will work a whole lot better. A trick that I learned at the recent North American Dental Sleep Medicine Symposium is you can just take little bumpers, they're called, from 3M, things you would put to keep your doors from clanging when they shut, little rubber bumpers that you buy, adhesive, you can put those in the back to go ahead and test out a new vertical for your patients. And it's a real quick way, and then we can add acrylic to them later. We can try things like the DNA appliance to expand the palate, or we can just give it time. Sometimes the devices, because of the inflammation in the airway, get better as the patient progresses 2, 3, 6 months down the road. Sometimes they even lose weight. And in worst case scenario, we'll have to discontinue treatment and try something else, some sort of alternate treatment that we can do. So between all those, we can usually come to some form of success. If we don't get to where we want or we don't feel the patient successfully treated, we need to work with our physicians to refer them for other alternative care, such as seeing an ENT, for possible surgery, other forms of CPAP, or other therapies that we can utilize in order to help our patients breathe better, stay alive longer, and live better. Well, I hope that's been helpful. Thanks again for tuning in and reading this edition of Dental Sleep Medicine Insider Magazine. Once again, I'm Guy Yatros from Dental Sleep Solutions in DS3.